This video shows disbudding of a goat kid under a general anaesthetic given by a veterinarian. First of all, the horn area is clipped to allow it easier to see the horn buds and to reduce the amount of smoke from the burnt hair. Next, the jugular area is clipped so that the jugular is easier to find. This particular kid, even though it was a reasonable age, had very small horn buds, so some white out was applied to ensure that we knew where the exact centre of the horn bud was. The black skin made it very difficult to see where the horn buds were coming through. Next, I'm preparing to give some buccal, which is a brand name for a meloxicam gel. I'm withdrawing the relevant dose rate out with an 18 gauge needle and syringe. This buccal gel is designed to be absorbed across the gums. So it's put in between the gums and the back teeth. And this provides pain relief for the next 24 hours at least. Next, the kid's normal heart rate and respiration are monitored and to check for any congenital heart abnormalities. Here I'm checking the dose rate for the alfaxolone anaesthetic and drawing up the dose rate for the kid that we'd previously weighed. So I've now got the dose of alfaxolone and it's going to be checked by my assistant. Double check the dose. Now I'm swabbing the jugular area with some methylated spirits, inserting the needle, very fine gauge, into the jugular, and giving the dose of alfaxolone by a very slow intravenous injection. Holding my thumb on the jugular to stop any bleeding, and then the kid is placed on a towel and I'm getting ready to monitor the respiratory rate and the pulse rate. Kid's ready for disbudding. The respiration's fine, heart is going well. You'll notice that the eyes were dilated, indicating anaesthesia. The hot iron is applied to the centre of the horn bud and rotate it gently around. you'll notice that we get a nice orange colour on the burnt area. Kid is sound asleep and doesn't feel anything. Next we apply an ice pack just to try and reduce any swelling in the area. The kid is kept warm while we're waiting for it to recover. Just checking that the top of the pole area is no longer warm. The kid will now begin to slowly wake up. Some antiseptic spray is sprayed onto the 2 wounds. And the kid is done. Now it's beginning to wake up. I'm just checking for lice, no lice, and trying to stimulate the kid to wake it up.